As the country experiences a second wave of the coronavirus, health practitioners are concerned about the health system and government's capacity to handle high infection numbers. COVID-19 figures have spiked recently, with the majority of new cases being reported in the Western Cape, the Eastern Cape, KwaZulu-Natal, as well as Gauteng. The Democratic Nursing Organisation of South Africa, or DENOSA, says the country is ill-prepared for the second wave. To discuss this further, we are now joined by the union's president, Simon Hlungwani. Simon, it's good to have you here on the program. Thanks again for joining us.
Thank you very much, and good morning to the viewers.
Simon, let's get your reaction firstly to some of the new restrictions that have been put in place by the president. Do you think this is enough to help the healthcare sector?
Well, we must appreciate the ones that have been changed and increasing a little bit. I must say we were expecting even more stricter restrictions, particularly when it comes to the curfew and when it comes to the sale of alcohol, because currently we are seeing incidences of accidents and many other trauma cases that are competing with coronavirus patients in terms of bed capacity in the hospitals. And we think more could have been done to avoid further exacerbation of such cases in terms of our admission and the bed availability in the hospitals. It is true that we are currently facing a serious shortage of beds, or shortages of beds, particularly in the four mentioned provinces, in Gauteng, KZN, Eastern Cape, as well as the Western Cape. And we know, we still say our country is ill-prepared for this because we are not having a resilient public health care system. And we know that majority of our country and the people in the country are reliant on the public health system.
Yeah, certainly is. But I just want to ask a little bit more about the capacity and beds in these respective provinces that have been highlighted. When you say it's not looking good in terms of bed space, where are we at? I mean, are certain provinces full to capacity? Is there still space? You know, give us a little bit of understanding from your members that are obviously working on the ground.
Well, the feedback we are getting is that there are few beds availability. In other words, we have a high number of bed occupancy. So at a given time, there is almost like full hospitals, and which is a problem because if you come in with any other admission, if it's accidents or any other chronic illnesses that you end up in hospital, for you to find a bed, you wait between 3 to 6 hours. And imagine if you are coming in as a case in point of an emergency, whether it's medical or is it trauma related, which has led to, in the Eastern Cape, a number of ambulances bringing emergency care patients, and they have to wait and queue for bed availability, which is a problem. Yeah. That's why we think more restrictions could have helped us curb and avoid, but also it's exacerbated by the fact that, the beds that were created in the field hospitals, like the Nazareth one that was created and many others, including in East London and in the Eastern Cape in general. There is no available health professionals to mend those hospitals. So we're not able to even fully operationalize those hospitals because there is no nurses, no doctors to mend those places. And it means that's why we're saying we're ill prepared, because how can you create 1,500 beds, but you don't have the staff to mend those beds? You don't have nurses to go and take care of those patients.
And this is a very worrying scenario that you're painting for us, because obviously, and the president mentioned it in his address last night, that we as a nation, and I quote from him, we owe so much to these brave and dedicated people and to their families, for without them, we would not have come this far. That is what the president said about healthcare workers and practitioners in this field. But the reality on the ground is that it's easy to say these words, but are you being given enough assistance from government's point of view? Talking about PPE, you're saying that there's just not enough staff at these hospitals, that the ones that are there are overworked. Talk to us about some of the challenges that your members are going through at this time.
Well, Leanne, I must say that sometimes talk is cheap. And our president keeps on saying we appreciate and we owe dearly these health officials and professionals. But when you look at the treatment that the health professionals are getting in this country, it's horrible. I must say it's horrible. Or I can even say at some point I said it's genocidal, because the same health professionals were given the KN95 masks, which, as we know now, the research has proven that some of those masks are not effective. In other words, I'm wearing that mask and I think I'm protected. I go and nurse a coronavirus patient, and I turn COVID-19 because of my not because of my doing, but because of the poor quality of the PPEs that I was given by my employer in this regard. So when you look at it, it's a horrible one. But I also say it's horrible because, as you know, the same public health officials and professionals, when everybody was on lockdown, they were there on the cold face where the virus was there, and they were working very hard to make sure they take care of everyone who was sick. But they were told, you don't deserve an increase this year. They were told you don't deserve even to be mitigated financial, when we said they must be given some form of risk allowance, because we think this is the last line of defense in terms of health in our country. But the recognition is never there. Over and above that, these are the same people who are short-staffed. They are not even given enough psychological support when they are stressed. Remember, most of the health professionals have died. I can tell you that in Gauteng alone, I think it's more than 78 at the current moment. But none of those who died have been replaced so far. So when you look at it, the numbers of staff is dwindling. And in terms of the contract workers, those who were employed for coronavirus care at the current moment during this state of disaster, they are employed on a 6-month contract, on a 12-month contract. But it is proving that we need them the most. They should have already been given permanent contracts at the current moment. They should have been given permanent employment, because at any rate, it shows that we need them. But currently, it's not happening. So you can see the treatment that is given to the same public health officials. It's horrendous. Because if you give them poor quality PPE, if you don't give them a wage increase, you are saying you can suffer, you can do everything. And these are the people that if they turn positive, they just go to quarantine. When they are done, they must come back and face the same virus again. Unlike in other departments where people can close offices, can close police station, can close schools. It doesn't happen in health. You still go in there when there's other people who are. And by the way, the stress of losing a colleague is very, very painful, because you begin to think, am I going to be next tomorrow? It's painful. And we wish somebody could understand that. But we appreciate the public, because you and the public are saying you appreciate the work we're doing. That is very much appreciated. Well, and it keeps us going on, by the way. Thank you very much.
It certainly does. I mean, but you know, there is reality, as you say. You know, we can thank you, but the reality is that the harsh. I mean, we heard the figures last night that were announced in terms of 38,000. This is what the president was saying. I mean, you can tell me if these figures sound right to you. 38,000 healthcare workers have tested positive. 5,000 of these admitted to hospital. 391 passed away. You were saying just in Gauteng alone, 78 passed away. So what you're saying is that those that are passing away are actually not being replaced, and that these positions are now, they just open.
No, not at the moment, because you will remember that our country has been behaving in a particular way in recent years, where we used to have what we called it a moratorium, and I think some ministers would have called it, and I think it's Minister Mtswale would call it technical moratorium, wherein if somebody happens to die, or you live by natural attrition, retirement, and so on, or you just resign from the public sector, they were not having, they were not replacing those posts, and this is what led us to having a dire shortage of nurses. The other part that contributed towards that was that there was a reduced intake of nurses into the training, just as you will remember that most colleges were closed and so on. But currently, those who have demised at the current moment, we haven't seen any adverts that are replacing them. And those who've been taken on contracts that were advertised at that particular time, they're taken on short-term contracts, 1 year, 6 months, and it doesn't mitigate the circumstances. But over and above that, the process of even appointing those nurses, if they were to advertise, you will see that it will take more than 3 months. And when you are in a crisis, how can you take 3 months to do a process of advertising, shortlisting and interviewing, plus appointing people? And it looks like we don't have the agency. We just don't have the agency. And we're pleading to say that must change. it must really, really change. And the appreciation of nurses must be seen. The World Health Organization has recommended that on annual basis, our country must increase the number of training by minimum of 8%. So at least 8% on annual basis of the intake of health professionals, including nurses. But the numbers of training, I think last year or this year, the intake was horrendous in that it moved from, in Gauteng, I can give in one college, they moved from around 300 to an intake of around 50. So when the world says move upward, our country is moving downward. It's a problem that we're saying. Even in the next 4 years, we will not be seen to be resilient because we don't seem serious in how we're doing it.
What does this mean for the second wave? I mean, you said it right at the beginning of the interview that we as a country are ill prepared for the second wave. We heard the president saying that obviously going into a much harder lockdown is not necessary because in the very first lockdown, this is where what we're being told is that the health sector was being prepared and things were being built and everything was being put in place so that these waves could be dealt with adequately. So now we're entering into a second wave. We've still got a country that is operating. We need to. The economy is on its knees, and I think, the president had a very big balancing act last night to kind of achieve between health and economy still surviving. However, what worries me is you saying that we are not prepared for this second wave, and we're not even seeing the peak of this wave yet. People are going away today. This is where the holiday actually begins, and we're seeing a lot of people now moving into holiday season. When you say ill-prepared, what do you mean by that?
Well, I think, Leanne, the president was spot on when he referred to the hard lockdown being the only and the best mitigating circumstance that made us at least survive a little bit of the first wave. Now, with the second wave and our ill preparedness, the only way to survive will be through behavioral change, because our health system itself is not prepared in that it will end up clocking up. If it clocks up, it means people will line up to get admission in hospitals, to get attended to in clinics, and it will be difficult. And at some point, there will be no one to take care of them, in that in a clinic that you don't have enough nurses there, if one turns positive, they can't continue to work. They have to stay home so that they protect the public. And the public now, we are pleading to say, if we are to win the second wave, the public must please protect us as nurses by complying with the necessary non-medical interventions. We know all those things: wearing of masks, washing hands, social distancing, avoid the gatherings. We love nice times as South Africans. Perhaps we must think very hard that this year is the year in which we must change the behavior. I must calculate whether it's necessary to go to that gathering big, and whether it is necessary. If it is necessary, I must then think very hard to say, I must comply with what is required to prevent this virus. So in other words, the public is the only one that currently has the power to change and make us survive. And if we protect the nurses in hospital, the nurses will in turn take care of those who get sick, and therefore will beat the virus. The behavior of drinking, getting drunk, driving at night, and having accidents, it will perpetuate the bed occupancy that is so bad at the current moment. So we are pleading with everyone. We can say in Setswana, tswe, and we can say in Xitsonga, habakombela. In all these languages, let's all behave, let's all prevent getting infected, because if things go worse, our institutions are not prepared to take care of everybody. And we know our South African society, we get impatient when we're waiting for beds in hospital. It's a problem that we're going to have.
It certainly is, and Simon, I think you've given us a lot of food for thought here, because as much as we can be dictated to by rules and laws, we are the only people that can control our behavior, and that's the reality, is that we have to understand that not only is the risk of coronavirus there, the risk of accidents. I mean, we were looking I think it was over the festive season last year, there were about 1,000 approximately 1,600 fatalities of just road accidents. So that adds to your drama and what the hospital capacities can handle. Just finally, as we close this interview, Simon, in terms of the demands from the healthcare workers, and we know that you also joined in with Nehawu. You were obviously one of their affiliate partners, trying to speak to government and let them hear your demands in terms of what is needed from the public sector for remuneration, for creating full-time positions. Where are you at right now? Have you heard? Is there a response? What is the next step?
Well, I must say that we have tried to engage the employer and finally tried to even engage the president of the country. You would remember that I once wrote a letter to the president, an open letter to the president. And in the response that we received, the responses are not promising per se, but with regard to wage increase, the implementation of Resolution 1 of 2018, the matter was ventilated in court. We are awaiting judgment. Now we are hoping it was ventilated at the Labour Appeals Court. So we are hoping that it will rule in our favor. But we pleaded for the conscience of the president that while you appreciate verbally the public health officials and many others that are currently working, can you also demonstrate that it is the same officials who have lost colleagues? Some have even died before they even realized their wage increase and before they even realized their risk allowance. Some of us have had family members who have lost their jobs. And our circumstances have now become worse. Some of nurses, spouses to nurses, brothers, sisters, siblings, parents, and family relatives now are dependent on our income to put food on the table. Now we are saying during those circumstances and even during the hard lockdown, nurses who were using public transport were paying double what they used to pay. Yeah. You know, in the taxes, when they say, if you used to pay 10 rand, give me 20 rand, otherwise you don't ride. There's nothing you can do. And you were going to work and the employer was not providing transport. So we are saying and pleading with the employer, still say, no matter what the court says, this is an obligation you had to pay your own people, not unless you demonstrate that you just don't care about public servants. And if that be the case, then we will see where it will end up. It means we have an uncaring government. And we thought we have a very caring government. That's how far we are at the moment. If the ruling comes in our favor, we'll be very happy. If it comes in the favor of government, and we suspect that because we believe that the employer is trying to frustrate public servants. That's our belief. If the ruling favors us and the employer wants to appeal the case, then it means indeed we have a non-caring government. We have a non-caring government. We do hope they won't do that. Thank you very much.
Simon, we have to leave it there. Thanks so much for talking to us. Simon Hlungwani from DENOSA talking to us about the fact that they believe that South Africa is ill-prepared for the current second wave that we're going through. All right, let's take a break, and then we're going to read a couple of your tweets this morning.